Okay, guys, thank you so much for joining us at our second week of our We Are Autism Parents Education and Empowerment Program. My name is Charlene Pinnock, and I'm the founder of We Are Autism. At We Are Autism, we believe that no parent should walk this journey alone. We believe that when parents are educated and supported, um, kids on the spectrum strive and grow significantly. Um, Tonight we have Coral Care team that's here presenting, and I just want to thank you guys in advance for coming this week, and also you're going to be back again in a couple of weeks. And before we get started, just briefly, if everyone don't mind, just introducing yourself. If you don't feel comfortable, it's okay. I'm just very grateful that we have you here.
I can go first. My name is Carrie, and although I'm not a parent of a child who has autism, I do have a member in my family that is autistic, and I also work at a school. I am just excited to be here just for the knowledge sake and just so I can, take whatever I learned tonight and implement it in my everyday life. Thank you.
Hi, my name is Jenny Morales. I have a daughter with autism, and she's 14. Her name is Janaili Santiago. Thank you.
I'm Denise, and I have a brother that's on the spectrum.
My name is Janira. I am an autism mom. I'm here to represent the Hispanic American Library. We're hosting these 8 weeks, and we're happy to be partnered with Charlene and We Are Autism. Here at the Hispanic American Library, we have started an initiative to be an autism hub, and we have started a support group that meets once a week. So we decided to incorporate what we had going on with Charlene to be able to bring you guys these 8 weeks. And that's my story.
Incredible. My name's Lindy Myers. I'm a speech language pathologist with Coral Care. I lead our clinical team. And I'm here with Jennifer Hirschberg Wise. She is an occupational therapist with Coral Care. And we're just here to share information on what we can do to help support parents, siblings, other people who work with autistic children in the hours that they're not in therapy. But our company does in-home pediatric therapy, occupational therapy, physical therapy, and speech therapy. We are all throughout Massachusetts. We're also in the rest of New England. And Charlene, is Jennifer ready to start, or would you like me to get started for her? I'll get started for her. Sounds like they're probably setting up, but Charlene, if you
No,
can.
I'm right here. I'm right here. Thank you so much, Lindy. Thank you, everyone. It's so nice to meet you all and see you all. Can you see me?
We cannot.
Okay. Oh, I got it. I got it.
And I will use my screen to share the presentation if you want, Jennifer.
That sounds great. Yep.
Okay.
Thank you so much. Are you able to see me now?
Yes.
Okay, wonderful. Okay. So, welcome. Thank you so much for being patient, and thank you for being here. And many thanks for We Are Autism hosting this, and as well as the Hispanic American Library. And I'm really happy to be here. I'm an occupational therapist, and I want to share that this presentation is going to be interactive as well as informative too. Um, and so, when you're ready, Lindy, if you can start sharing the screen, the presentation, and we'll jump right in. Thank you. So the focus is going to be parenting beyond therapy hours. Um, and I really want to impress people with is that your therapist is looking to you to be the expert on your child as you are. And we're looking to tap into your knowledge and also to to give you different strategies and techniques that to help support your child's development too. Um, yep. So there's therapy. You're meeting with a therapist once or twice a week for about an hour each time. So that's 2 hours out of the 168 hours in a 7 days, 24 hours a day. So your involvement and your advocacy and your engagement with your child, with your therapist during your sessions are going to be really important to really supporting that child's development as well. We can move on to the next slide. Yep, right there. Yep, the skills don't transfer by themselves. That isn't a failure. Something really important for parents to know too is that this development is on time is on your side, and development will come, but it takes time, and it takes a lot of repetition too. So it's learned in context. You're not going to learn how to make a request or ask for something with communication, or how to use a utensil properly, tie your shoes, brush your teeth. These are it's when you have the skill, it's hard to remember a time when you didn't have the skill. But our little ones, they're new to this world, and they're learning, and they're looking to you to model what it looks like to do the task, and where do you do this. So their brains and their nervous systems and everything is developing, and they're learning for looking for patterns, looking for clues and cues, and they're looking at you to be their role model. So in addition to figuring out where to do, like you could brush your teeth at home, you could brush your teeth um, at the neighbor's house or a grandparent's house. So seeing where the skill takes place or the activity is going to be helpful for their learning. Um, Generalization takes time. It's not a one and done. It's not going to be like you have therapy for a few weeks and they made some progress. Maybe instead of, say, they dislike hair brushing, hair washing, teeth brushing, maybe now they can tolerate holding the toothbrush, or putting soap on their head and letting the parent kind of like suds it around. Um, and this sometimes therapists say, here's your homework, which nobody wants homework. Adults don't want homework. You have enough to do. But it's really something that's going to be helping your child develop. So it's, think of it less like homework, but maybe more like just creative opportunities, and finding those opportunities to help develop that skill. It's also important too that you're very clear on what is the skill, what are you working towards, and if you think there's a priority of another skill, then having that conversation with your therapist to say, I really want to focus on this skill, and then that skill too. Maybe pretty like keeping a jacket on, or keeping a sweatshirt on, or being able to tolerate or and accept being flexible with different clothing choices. Maybe that's the skill that's going to be more of the priority than can they tie their shoes yet. And I want, if people have a question, please just, and if you're on Zoom, please just kind of put your hand up, and then we could kind of engage and have more of a conversation. Yep. Can you move on to the next slide, Lindy? Thank you. Thank you. So there are five ways to use the remainder of the time outside of therapy. We talked about know what you're working on, and get creative with it too. It doesn't have to be. It might be helpful for the young person, for the child, to practice it in concrete, like in a concrete setting, like I said before, teeth brushing. But maybe make it fun too. So instead of having this task driven and oriented approach that we have to get this done because we want to show you're making progress. Be like, let's just look at the toothbrush. Maybe look at a couple of different toothbrushes, and maybe you just comment on the color, and then maybe you feel the bristles with your finger, and then maybe they'll tolerate it, like in their mouth. So being playful, I think being playful and being creative with it in a way that drives interest rather than boredom or kind of like that pressure. Because I think um, individuals with autism, they can be very concrete, in that they want to know what to do and how many steps it may be. Oh, something just okay. We hang on. Something's happening with the computer right now. There you go. So be playful, be creative. Thank you for that. Be creative, and inspire curiosity rather than being like a taskmaster, or keep it playful and keep it light. Um, Find where it already fits in your day, and so you're not going to say, "Hey, it's time for bed, but let's have a snack." Right? Let's talk about like having a snack or doing something that's going to take away from sleeping, as an activity. Um, so find where things make sense, and keep judge for yourself to be like, is this time to explore, or is this time to be more of a functional task? Because like, for example, like if you're doing teeth brushing and it's time to do that before bed, maybe that's not the time necessarily to set aside 30 minutes to comment on three different toothbrushes, in terms of color, in terms of sensation. Maybe that's something that you decide to do during that 30-minute period earlier in the day and say, hey, we're going to use, the pink toothbrush, and all the other toothbrushes, they're sleeping now, or they're just not available right now, because they're away, and that's what we decided earlier today. I was told storytelling helps kids on the spectrum help knows. Hang on, let me see here.
I could just,
Yeah.
so I was told like
Oh,
storytelling,
you can see. Thank you.
storytelling like help with kids on the spectrum. Like for example, if you make a story about what to expect, then like if you want them to like engage in brushing teeth, if you like basically create a story pertaining to brushing their teeth, and then they could see like the steps,
Yeah.
that helps.
Yep, storytelling is great. Social stories are really good. I know, like when it comes to toilet training and really any of these developmental milestones, there are stories. You can look at your library, um, and you can even look online and just find something that you can look at in terms of electronically to review together. I think it's important, depending on the age of the child, that you don't overwhelm them with steps. That you might keep it, depending on their age, but keep it to, like, I would say for the younger ones, I would say like two steps. For like teenagers or middle schoolers, they might, up to like 5 to 7. But also be really aware how much information is being brought to this young person or to this child. And also, that brings me to the next point: regulate first, always. Regulate means make sure that it's calm enough, situation that the person is receptive to trying something new. So, like, if, and also notice how you're feeling too. If you're feeling really stressed, the child is going to pick up on that. Remember, you're the model. They're going to pick up on that stress, and they're going to either respond by either people pleasing, or they're going to shut down, or and it's going to be it could kind of become like a struggle, where everybody leaves that interaction feeling less connected, and more dissatisfied with the task. So I think make sure that you're in a calm space, and then also prioritize what really is important that needs to get done right now. Maybe it is brushing the teeth. maybe if it's not as thorough as you would like because it wasn't for the however long you think it would need to be, but maybe they put it in their mouth and they rubbed it, they moved it around, and maybe they'll let you do the rest. So that could be something too. Always kind of think to yourself, is this a calm situation? Is this going well? And if it's not going well, find a way to modify it, make the demand a little bit lighter, easier for the child. And then also you have a very important role too. Think about what is it going to make it easier for you. I know when I was like a new mother, I created like stations stations of activities during the day when we were home together because I didn't want it to just I didn't think I would have the I wasn't the like the bandwidth to think about what fun activities can I do during the day when I'm tired, when I'm washing clothes, I'm trying to take a shower. So I think that that's really important to say what's the most important thing to happen, and give yourself, I would say, grace and your own, preserve your own peace too, is really important to your nervous system, which is going to only support your child's nervous system. Um, Repeat in more than one
I would
place.
love to just quickly jump in on the storytelling
Okay,
as a
yeah,
speech
please.
pathologist. And I'm gonna, as we talked about at the beginning, like we'll talk more about communication with me in a couple of weeks. But I think that storytelling really supports regulation as well. So, like Jennifer said, the social stories, those can help kids to understand what's going to happen. Like, if we think about our first experience ever at a dentist, or, like Jennifer today, like not knowing where to go at the library, right? Like all of that, it can dysregulate us because we have no idea what to expect. So when we give our kids social stories that just outline what they're doing and we just read it over and over again, it can really help them to feel calm and regulated so that they know what to expect going into something new. So it can be something like toothbrushing, where they kind of know what to expect, but for whatever reason they're not ready for it. And we can just talk about all, like, you can make a social story that's just, I'm going to touch a toothbrush, or I'm putting toothpaste on the toothbrush, or you can make one that's the whole process of brushing every tooth in your mouth and rinsing and all of that. And if you are the person you're supporting has a speech therapist, they can absolutely help you to create this. Um, even, I'm I found a story online. My son had to get his adenoids out, and I found a story online just all about the process because, of course, he was maybe 2 or 3 years old. He wouldn't know what to expect going into that. And then for me as the parent, because we read it so many times, kind of thinking about that regulation, like I also felt regulated because I knew what to expect. I also knew how to support him and what to reference. And that he would, even though, of course, he was still scared, feel a little more prepared. So we can talk about that a little bit more in a few weeks, but I think those go hand in hand together a little bit. So I love that question.
Yeah. Yeah. And I also think to consider the environment that you're doing the task in. Is it pleasing to you? Is it pleasing to the child? Music is a wonderful way for regulation. Breathing, just taking everybody. If I invite you to take a nice deep breath right now, inhaling and exhale, and notice how I did lots of breathing like that as I was kind of approaching to figure out where do I park and where do I go. So I think it's really helpful to come on in so that you're centered and grounded yourself too, and thinking about the ways that regulate yourself, and that could be something that helps your child, and also kind of honoring what helps them regulate as well. Um, Repeat in more than one place is going to be important too, so that they're seeing that skills it promotes flexibility, and that skills can take place across in different environments too. And also it's important to help with that flexibility because maybe you're like brushing your teeth or you're doing some activity in one place and it's the same activity but it feels different. Maybe you're using a different colored toothbrush. Maybe you're in a different you're visiting family and friends and you're doing something different. Maybe snack, like the foods are different. So it really just promotes flexibility. And then share what you see with your provider. have a little communication journal, or like use it on your phone, and just record something that you want to bring up at the next therapy session when they either come to your home, like with Coral Care, or if you're going to like like a clinic somewhere else. All right. Any questions at this point? What's that?
You never ever end up. You never have a question.
You have a question?
You never.
Yanira has a question. Okay. Yeah. Thank you. Thank you.
I don't have so much of a question. What I wanted to share was when you guys talked about storytelling and just knowing what is coming next. So my son's now 19 years old, but when he was younger, 4 and 5, and he didn't have the skill set to communicate that much, I did something very simple. I'm not sure if you could see it, and I'm not that good of a drawer, but I would do these. Can you see it? Man.
Go back a little bit.
I think it's kind of blurring out right now.
There you go.
Technology. Okay. A simple checklist. So we would start off the day, and even just him checking off the first thing that we were going to do that day, when he was okay with brushing his teeth, when we finally got to those things, I would let him know what we were going to do next. And I always made sure to do only 1 or 2 tasks and then give him a choice time. So in his choice time, he could choose that activity. So if he liked Legos, if he liked whatever it was, he'd get to be rewarded with that activity. And then we move on to the next one. But I would draw him the little pictures. Okay, we're going to be able to go to trampoline after you do this, or whatever it was throughout the day. I wouldn't make it too long, maybe like 10 items throughout the day, maybe 12. But I know story time might be easy for some people. Some other people can't, they'll have the imagination, but something simple like that where they can visually see it. Even if they don't know the words, you're repeating the word, you're showing them the picture, and they know what that picture pertains to. It definitely, helped me to manage my day when he was younger. So I just wanted to share that.
Thank you. Thank you for that. Thank you for sharing that. Did you have anything further to say, Yanira? Your hand is still up, which is great.
Oh, I don't. Let me see how to lower it. Okay, we're good.
Okay, that's okay. Okay. Anybody else want to share? And something, if you want to just share something that's worked for you, or something that you think about when you hear, like regulating or finding where it fits in your day. Okay, we're having really technical difficulties here.
Sorry, your video was off. You can use my phone.
Okay. All right. I don't see any further questions.
I have a
So
question.
maybe we can move. Oh, go ahead.
And just a reminder, I'm not around like children who are autistic, but I'm curious. Again, I work at a school. I do have a family member.
I don't know.
So these strategies that you're sharing, do they work for both verbal and nonverbal children?
All
Can you
right.
hear me?
I'll answer that as a speech therapist. Absolutely. And usually the things, like Yanira was showing on paper that have symbols, and it's really more receptive. So meaning it's really more about the person understanding. So, like the stories we talked about, understanding maybe more of an experience, or just knowing what to expect from their day, knowing that they are going to get some free time later, or okay, I don't like lesson one, but I know that's coming, and so we're gonna do it. But after that, I get to do this. Um, we all use a calendar. It's like a similar, visual task. Um, so it's more just the understanding there, and the repetition will allow them to understand the symbols. They don't have to be literate. You don't have to use word, text. You can just use those pictures, and just repeated exposure will help to them to understand what those mean.
Awesome. Thank you.
Question.
I think it's also important to have like a time limit too, so that people and yourself as well as your child knows when is this over? When is it over? So it kind of helps with that predictability, and also understanding, like, let's just say if they're going to be a little frustrated or they're going to try something that's a little challenging. Knowing when the endpoint is makes it easier to cope with it because they know that after they do this hard task, they'll do something fun. All right. Can you move on to the next slide? Okay. Thank you. Okay. So carryover sometimes breaks down because parents were never told that the goal or how to do over like outside of therapy. And sometimes you are in that role to ask, I want to do this at home. What can I do? I don't maybe have the equipment that you're necessarily working with, but what are some quick things that I can find around my house that will work? Um, and thinking and asking them, what are we working on right now? And I think encouraging, asking questions, I think there are always great questions to be asked. And I think if you walk away from the therapy session feeling pretty confident and you know what you saw your therapist do and why they were doing what they were doing, then that's going to be a good, successful part of a successful session. And thinking about what practice looks like at home. And then how will I know if it's working is speaks to the question of how are we measuring success? Um, how do we know, like, are we all in agreement on what success looks like? And if there's a disagreement or a different of opinion, then I think getting clear on how are we going to measure it, what's the goal? Say if the therapist says, that you began and it took the child like 2 hours to go to sleep, and you're like, I'd like this to my hope is that we create he or she can sleep like settle down in bed within like 30 minutes, but the therapist is saying, well, I think an hour is more realistic. That's like a disagreement between what the parents' expectations are versus what the therapist is. And it could be for anything that looks like it doesn't have to be going to sleep. But it could be any task. Um, not specific enough saying we're working on communication. It sounds when you hear it, because you're going to be exposed to lots of different like information during the therapy session too. But work on communication. Well, what does that mean? Does that mean selecting a visual like icon when they want something? Does that mean saying thank you and please? So here's something a little more specific. When he reaches for something, wait 5 seconds and give them a chance to request it too. I think that is also important. And when you encounter like somebody who is on the spectrum and you're living with them too, and if you have a different like a different nervous system, if you're not autistic yourself, um, being really aware that that what you're experiencing can be drastically different than what they're experiencing, like their world. Like right now, we're sitting in this room. There's an air conditioning on. I find it pretty quiet and soothing sounding. Somebody else, whether they're autistic or not, might find it so loud that they are like, I can't concentrate on anything that's happening in front of me because I'm so tuned in to that loud air conditioning. Um, and it's not a matter of defending the volume of the air conditioning. It's a matter of recognizing, you're having difficulty with this because this air conditioning is really loud. Let's go to another place where it's a little softer, or let's turn off the air conditioning so we could focus. So I think that's really important. Another important point too, that we are all sensory beings. So you'll hear a lot of like the words like sensory and sensory integration and sensory processing. You need to process sensory information before you could integrate it. Um, so I think that being aware of the environment, what really works for your child, what works for you, um, and then really kind of developing a plan that is going to be therapeutic for that child too. And uh, going back to my original point, that you're the expert, because you're with them all the time. And you're the expert. So, uh, you know, I as a therapist, I love bubbles. Bubbles have been great breakthroughs for me and students or me and children who really have a difficult time interacting with a stranger for the first time. So keep in mind, like let's just say I'm the therapist that's coming to see you, and I think bubbles are the greatest thing in the world, but you're like, bubbles scare my child. So you're right because you have that valuable piece of information that this intervention is not going to work to engage with the child too. And in fact, it might actually backfire on building that therapeutic relationship. Thank you. All right. Can we move on to the next slide? Okay. Yep. So find where it already fits in your day. Um, don't say, oh, we need to increase the frequency because the child needs the therapist. You get to be the parent. Like you get to be the parent. You don't have to be like, well, great, now I'm stepping into a therapist role. You will always be their parent. You should always stay their parent too. So I think that's also going back to regulation. I don't want you to, I like to encourage you to stay in your parent role. Love this child as they are, without trying to therapeutize them, and try to do things like ongoing with a lot of repetition so that it becomes very very burdensome to yourself as well as the child. So looking at requesting, um, and it could be requesting food, it could be requesting a toy, it could be requesting a nap. And I think also modeling when they've had enough. Um, if they're nonverbal, develop a sign. Maybe it's putting a hand up, or maybe it's just kind of like just picking up something that just says, I need some space. That could be a really great, empowering way for them to advocate for themselves, and then to hear them demonstrate, I need space. That helps with regulation. That can help with any interruption or anything that becomes like almost like a power struggle. Transitions are really hard because you're doing the fun thing and oh my goodness, now it's time to go. Or because now we got to do another fun thing, but I was really into the fun thing I was just doing. um so every time you leave the house or end an activity, sometimes preempting that, saying, okay, in 2 minutes, we're going to go, and incorporating maybe cleaning up as part of that transition. Um, we talked about social stories. We talked about, I wanted to also bring up music too. Music could be a great way and a very powerful way. And it makes it external. So it's not you like verbalizing, it's time to go. You better clean up because we don't want to be late, traffic and everything. Um, but if the cleanup song comes on, oh, that's what we do. The cleanup song is on. It's not parent telling me what else I need to do, and you're not burdened with that task of being like being the timekeeper of the event. I see Shanice wants to add something. Please go ahead or has a question.
Hi everyone. Just to add to that clean song, it's the same here at my house. So Kason, July, he's gonna be 5 years old. Our biggest issues was getting him to eat meat. He hates meat.
Yeah.
And I remember we were trying to get him with songs to try it. We tried pureeing it, deboning it. We tried using the pictures to get him, but his mind was just made up. And I was like, you know what? I'm not going to force you anymore.
Mhm.
Then we were trying to learn him to get him to clean up. He loves the clean up song. He'll follow his sister. He has a 6-year-old sister, and she'll be like, "Come on, Kason, let's go." And he loves it when he does it with her. But if I say, "Oh, Kason, can you pick that up, please?" He just walks away. Like
Yeah.
it's nothing. The biggest thing the hardest thing to get him to do was to at least try something different.
Mhm.
After a while of trying, we tried a nutritionist, everything. We realized it's just a texture thing.
Mhm.
So everything for him is liquid, applesauce, soft. Um, but this boy, if you put a piece of meat in front of him, it's like his old demeanor changes and he's mad.
Yeah.
No,
Yeah.
like it's like when you say no nap, no meat.
Yeah.
Just no meat. So I find that those also help. The cleanup songs in the books really helped a lot to get him to at least try sipping from the sippy cup and trying to put his pull-ups on by himself and put his clothes on by himself. And uh sometimes even when he gets agitated, he knows when his pull-ups is dirty, he will take it off himself and he will carry it and throw it in the bin and then come to me and look at me like mommy pull-ups. And
Yeah.
I find it so great. And I'm like, oh my God, you just need to get to the last part where you just grab the pull-ups yourself and put it on. You know how to take it off. You know you need to take it off. You know when
Yeah.
you're done with it. Now we got to figure it to put his clothes on himself. The books were fantastic. To today, he can identify every dinosaur. Sometimes he will count in Spanish. I don't speak Spanish, but those songs and the books, he's just, you're counting in Spanish. I'm like, you saying Spanish? Okay, oh, go. Let's go. Let's count. Encourage him. Let's go. Come on, let's do it. ABA services helped so much. Early early childhood development helped so much. I have to say thank you to you, therapists, because your work is. I had 10 year worked with cases. So I love her. I have to pray for her because it was not easy. But all of those suggestions you guys have given so far has helped Kason to even come to me as his mom, pick up his Pediasure bottle on his own, and ask for it to be open. He'll bring it to me and hold it and say, open. He's coming from where he was not saying anything at all.
Mm.
When he's frustrated, he will come to you. He won't sit and get upset anymore because now I always say, Mommy, help. Mommy will always help you. Come on, Mommy, help. When he cry, Mommy, help. My daughter does my daughter does help along with it too. She is one of kind of my support. She's 6 years old. She knows that if anytime you need help, come to mommy. So when she sees Kason getting upset, she be like, Kason, no, help, mommy, mommy, help. It is I can't tell you how happy I am, but I gotta thank you, therapist. I mean, you have been doing oh, it it was from him not talking, not knowing how to help my child. I felt helpless. I didn't know how to help him at all. And I was scared that I was doing something wrong. I took him to every doctor, and then when I finally got a diagnosis, I was like, how do I help him? And I had to sit in ceremonies like this. I had buy books. Music was the biggest thing. He loved it. And I just fed into that, encourage him, not making him feel, there are times when I have to use a commanding tone because he's a boy. He's stubborn. But for overall, in terms of like, now I don't have to worry about him cleaning up. After he finishes a Pediasure bottle, he runs right to the bin, opens it, throws it in there, and closes it. And he's done.
That's wonderful. And
Yeah.
I think that you brought up some really good points, like the importance of having a peer model, like so his sibling, his sister. But if the child's an only child, well, what do you do then? With friends, with family, who have like children, even if the child's older and not the same like contemporary of like a peer of the child, they're watching everything. So
Yeah.
the child that doesn't want to use the bathroom if they are in a social situation, a birthday party, and they see everybody or a dear friend going to use the bathroom, they might try that. They might see what it's about. And I think, with your point about he does not prefer meats. Um, who he is now is going to be drastically different than who he is when he's going to be, next year and the year after. So I think praising what he is doing is going to go a further way than, putting like a ground turkey or ground beef or pork in front of him and saying you're not going to get anything else until you finish that. Like it's just going to become a battle. And it's also like think about the a food you don't like. If there's or something and somebody says you have to eat this before you do or do something, you'd be like I can't because I will be, I will gag or I will really have like an adverse reaction and I won't want to ever do this again. And then that kind of deteriorates trust. I think it's great that you're saying mommy and all moms want to be there for their children ideally. Um, and you're like their safe center. And as you remain that safe center, that means honoring where they are. And if that means they are not comfortable eating a certain texture, but they're
Yeah.
still gaining in weight. They're still accepting other foods. Well, that's
Mhm.
great. And then maybe it could be like he's interested in Spanish. Maybe you just talk about, hey, did you know the word for chicken is pollo? And then let's look how many ways there are to like prepare this type of food. Not talking about eating it. We're just talking about it. We're just exploring it. You see
We
the
tried
laughing.
that.
Yeah, yeah.
We
Okay.
tried we tried that, and we even tried to use the name cards because for in my house right here at my living room, I have like a whole section where it's just like name cards, stuff like this, and his books, and I have like a whole section side of his books, everything. So sometimes he'll point to me as to what he wants, and but every time when I bring a meat in front of him, all he points on is the all done sign. He
Hold
just
on. Well, he knows what he wants and what he
he,
doesn't want. No, I think y- yeah, I think, praise as you're doing, and if there's no concerns about growth from his pediatrician, then then it might be like something that the parent needs to say, is this a battle that I need to fight today? Or is this something that needs to be addressed right now? So like we're talking about sensory tolerance, which talks about like there's like food textures. And if
Mhm.
like you want to try a different texture, I see your hand raised, Carrie, and I'll be right there. I'm maybe good to hear what you have to say. You could try to change the texture, and these are great things that if you're working with your therapist, say, hey, my eating this or at least trying it is really important to my family. What can I do so that it becomes less of a battle of wills and we could kind of facilitate that acceptance? Okay.
We
Thank
kind
you.
of made goals towards it that with it. We kind of made goals towards this therapist. So every time food is eating something is the next thing, and
Mhm.
also getting him to make a statement. That's always our goals to have him make a full statement and to try something else if he's interested. But I don't force him. He has three signals. Once you try, he'll put his hand up. That's the first signal. If he goes again like this, that's the next signal. And the third time he probably hits you. So I don't force it. Once I see the first two signals, that's it. We're done.
Everybody's learning. It's wonderful. That's great. All right, Carrie Ann, I want to hear what you have to say. You're welcome to unmute yourself and share.
Hey, and I lowered my hand because I got caught up with Shanice's story. I enjoyed listening to her and learning from her.
Mhm.
Um, I want to go back to the music because in my mainstream classroom, I often hear some students, mention that they like to listen to music as they learn. And whereas others will say, they can't work with music. I'm curious to know, as it relates to children on the spectrum, does the type of music matter? For instance, like common music, instrumentals, does it matter, or is it just something that a parent would have to do just to see how their child reacts or respond to the different types of music?
I'm going to pass that to you, Lindy, if you don't mind.
You got it. Excuse me. I think just like everybody else, the type of music is totally dependent on the person. So, um, I might like calming music sometimes, but sometimes when I'm really anxious, it almost like can't doesn't get me out of my head enough, and I actually want like really upbeat music I can like scream and sing, scream sing along to, and that's actually more relaxing for me than,
Mhm.
maybe some classical music. I am the type of person that I learn better with music. I retain things better when I put them to songs, make up wacky songs around things I'm learning. So I think it's just their own profile. And you can, yeah, just see kind of how kids respond, um, and go with that and just honor their preference.
Yeah.
Yeah, great question.
Carrie Ann, are you ask? It sounds like you're saying I'm a teacher and I'm interested in how music impacts my students' learning. Is that what I'm hearing you ask?
Well, that's something that I experience in my class daily, but I was more curious about knowing how children on the spectrum, like if they had a preference or it's just a matter of, you know, which you guys did a great job answering the question.
Yeah, no, I think I'd like to add too. One, I think it could be unique to an individual. I remember when I was working in a school, I had a teacher say, "Oh, I think I need to introduce music because all autistic children love music," and I think that's the danger because all like there is no
Hmm.
you can't if you've met one autistic person, you met one autistic person. Just like if you met one, you know I don't know. If you met one person, you met one person. You have to be really cautious about generalizing that, okay,
Right.
if you have this diagnosis, you all do this. And I think, as from a teacher perspective too, sometimes students may say, oh, I need to listen to music. And it could be avoidance. They could be like, well, I'm listening to music and I'm so into the song. And then you'll see how like their performance is. So I think if it enhances the performance, then it actually is doing like what the student claims it's doing. But if all of a sudden like they're off task and they're not,
Yeah.
completing their work because they're so involved in the song, and then they got to listen to this song, and then they use it to, show their friends, hey, you got to hear the song. Now it's
Mhm.
becoming something different.
A distraction. Yeah. I
Yeah.
used to be against it a lot, but over time I've learned that, music does help some students. It enhances their focus. It makes them focus better. But I know for me, if I hear any bit of noise as I'm like learning, studying, like I can't focus. So I've learned to adapt to the different individuals, like you said. You
Yeah.
can't group everyone together. Some people like really need it to help them.
You could
Yeah.
also think about music not like during the task, but we were talking about visual schedules, and just like Shanice said with her son, like understanding the cleanup song and that makes him clean up, you can use music to just cue kids and anyone into what's going to happen next. So even if they're not listening to it while they're learning, you can start to play a song that signals, okay, you have 3 minutes left, right? We're going to play a 3 minute song here. Um, or then like a transition song, and it's keep it consistent every day, and that really helps. If you play something like at the very beginning and then at the very end, kids know it can help them really understand exactly what to expect within that. um so yeah, there's so many awesome ways to use music with kids,
So
with all of
true.
us.
I think
So
it
true. And
also like in music, it could also be colors. Like I know I retain information differently if I use different highlighters. So even if I'm like, I remember the content was blue, and that referred to this section, and then I did the different section. I highlighted some keywords that were pink, and so it just helps learning too. So I think it's an exciting area to like look into too. I'm being mindful of time too, and I see that Charlene is adding in the chat. Oh, okay. Okay. Thank you so much. I know. Oh, it disappeared now. Just go ahead. Just go ahead and tell us.
Saying that my son, when he was in grade school, he had a teacher that was a special ed fourth and fifth grade, and she played jazz for the students. So nothing with vocals,
Yeah.
and the music was calming enough to get them to get through their classwork. And they actually would come home. We had a friend in the classroom, and they both requested to put jazz so they can get homework done.
Okay.
So it's definitely different for all kids.
Yes.
But I think it's something they couldn't connect like a top 20 or top 50 song that they'd hear often. That would probably be distracting for my son. But something that was just music where it wouldn't distract him because he wouldn't know the words and he wouldn't know the song, just the music seemed to calm him down.
Yeah. Thank you for sharing that. All right, Shanice, I see your hand up, and yeah, I'm looking at the time too. I want to make sure we can get through, but please, I want to hear what you have to say.
Just quick to backtrack on what Kerry said in terms of music, in terms of for the autistic children. So when Kason, he started Frederick Harris at pre-K, he was in a bigger class. I think most of the time for some autistic children, it's the sound waves from that type of music. I gave Kason a hearing test at Holyoke, and what I noticed that when they were playing certain bass or certain tones, he can't stand it. It triggers his ears. Like when he hears a muffler off a bike, it is like he clutches on real quick, and or if certain, like the plane sound from the from the engine, from the sound of a plane, it gets him real riled up. I had to literally switch Kason from a bigger class to a smaller class because he cannot. The it's the sound.
Yeah.
So when he got into the smaller class and he can actually like listen to the music, play with the stuff, hear what is saying, he's more comfortable. But when he's in a bigger class with all other kids around his age screaming, doing the he can't stand it at all. He would hit kids. The hitting was bad. He would hit. There was one particular girl, she screamed for everything, and he couldn't be near her. And it was the sound that was really bothering. I had to buy him headphones.
Yeah. The noise canceling
So,
headphones.
yeah, and when he got into that smaller class, he didn't need the headphones anymore.
Yeah,
He
good.
was more focused because they weren't like a whole bunch of 10 kids screaming all at once with that volume. He could hear the music that he wants. He could play the stuff that he wants. And I was like, okay, this is the thing. You can't, even if I'm here and if I'm talking too loud, he runs in and looks at me like, what's going on?
Yeah.
I can't have an RN. I can't scream
I
too
I think, what I heard you say too is that you really trusted your intuition to that instead of having him in like a large classroom, you advocated for him to be in a small classroom. And I think that advocacy and that recognition of your own child's needs and strengths is so important as a parent too. Let's move on to the next slide. Thank you for sharing that all. Thank you. I love the engagement. Yep, we did talk about this regulating first. Um, Make sure you're regulated to have a conversation or to make to see where you're at too, and that might mean take a breath, or it might mean tell tell your child, "Mommy needs a few moments, mommy or daddy or grandparent or whomever needs a few moments, and then we'll get back to what we're doing." And I think it's okay for them to see you model it. It's okay to show your child you're human. You're a human and you need a couple of minutes to yourself to get centered and grounded before you could engage. And they may have like, they may take exception to that. And they kind of like try to up the ante a little bit to get your attention. But I think depending on their age and the question of safety, um, that's good to model because then they will be like, oh, instead of hitting somebody, all I need to do is tell them I need a moment. Oh, wow. So think about what regulation looks like. It's different for every child. Some of it could be the crashing, the jumping, the heavy work or proprioceptive work. Some of it could just be I need to shut the lights out. I need to go sit in a room and I need to curl up in a ball. And it doesn't mean that it's wrong. It just means that that's how they find their center. Um, Yep, and it could be a snack. And it could just be It could be having a couple of moments, or it could be listening to heavy metal, or it could be doing something like stimming, like, and that could just mean humming. It could mean pacing. It could be flapping hands. It could be something that brings them like to their body too. And I think a lot of what we're talking about in an area that I'm really interested in is something called interoception, which is kind of like knowing what your body's doing and not physically moving, but just kind of checking your internal state. So like um, if you're sitting in traffic, traffic is a wonderful teacher. Um, you could realize, you could notice how your body's feeling, like the tension in your shoulders, where your mind goes in terms of, is this traffic ever going to move? How do I get out of this? And then kind of really becoming more mindful of where you are. Um, and as well as if you're like in a regulated state, your child will be too. Um, when you when you find yourself pushing through like dysregulation, that could feel like exhaustion. Um, Nothing successful comes from that. The practice, the performance, it rarely is as good as it would have been if you were in a quiet, calm state of mind. Um, First, you regulate yourself, and then the same practice often goes fine too. Um, and pick the one routine where the practice falls apart. And then think, what's the routine? Are we calm? Is it kind of like trying to get things accomplished within a short period of time? Um, and then kind of and seeing what works. Let's move on to the next slide.
I have a question.
Yep.
Um, so I think when a lot of us think about dysregulation, it's easy to think about hitting, falling to the floor, refusal, um, kind of like that, like peak escalation.
Yeah.
But like, I think some of the things that I find harder, um, whether it's myself, an autistic person, whomever it is, what are kind of some of the signs um, that people are becoming dysregulated that might not be so overt?
Mm,
And you mentioned, for example, like stimming, and that could be things like humming, flapping, you know, for some people that is a sign of dysregulation, but then for some it's a sign of regulation. That's someone's humming because it helps them regulate um and they're happy, like it's a happy hum, it's a happy flap.
yes.
So maybe the answer is there's no one way, but like what are some of those
Yeah.
less obvious signs that someone may be starting to become dysregulated so we can support them there instead of up here.
Gotcha. Yes. When I think you have to be become like an excellent observer and as excellent observer and like a detective of what was happening immediately right before there was a dysregulation. Maybe it was like throwing things. Maybe it was like words, like words, physical actions. That's where like with ABA, I'm an occupational therapist too, but I've worked with ABAs. Um, they do like a functional behavioral analysis. And that kind of says, okay, this happened right before this event took place. What can we do? This behavior took place. What did we notice? I know for one, the point you made about like humming, there was one student I worked with too who it would sound like a happy like hum, but he's getting louder and louder, and that usually was a sign that he's about to start grabbing and pinching. And he's nonverbal, so he can't just say, "Hey, I want to, go to the bathroom." Um, so I think noticing the person, there's demeanor. Um, this particular person's like his eyes would dart left to right, and he would get a little close to you, like not really respecting boundaries. But I think he also some of that dysregulation could be he's nonverbal. He wants to connect with somebody, and if I'm pinching you, I'm touching you, and you're responding, and I might have other people come over and start like kind of like holding me away from you, but I'm getting all these people around me. Maybe this is a good thing. So I think that that's where that that analysis comes in of looking at what happens to this person before this behavior And what's the result? Like if you see like, wow, we did this and the behavior persisted, well, that person is getting positively reinforced with it. Um, and if that like if there's something else that the person wants, and the behavior stops, well then we're looking at the function of the behavior. So I think it depends on what happens after. And also, I mean, I think like it seems like anything that's outside of the neurotypical is something like the neurotypical seems to be like the typical approach seems to be like the standard that people who aren't like who are neurodiverse kind of are held to. So it's kind of like apples and oranges because somebody who doesn't like a certain type of food beats or something that is like I really can't be around people too. Um, they may look socially appropriate because they've learned that they have to be socially appropriate. Like this is where masking comes in. Because at the end of the day, like their social battery, their ability to be outside of their own like space becomes so diminished that like at the end of their demand of being like in school, going to a party, that all they want to do is just lay in their bed because it could be physically exhausting too. So I think that like there are subtle signs, and I think I appreciate you bringing that up too, that there are subtle signs that they may look socially appropriate, but it could be somebody zoning out. It could somebody meaning like I'm just shutting down, or maybe they're going to run away, um, either from a home or from a school, um, or the room. So I think really being mindful of like analyzing it too. Um, Charlene, please.
So one thing I could say, like as a parent, we get to know our children. So we don't have to like just rely on services
Yes.
to pinpoint like certain behaviors. We as parents know our children behaviors even better than the services. So I like where you're talking about knowing like what happened before. And we as parent, we should take note of that. Like what happened before and like so the next time we could intervene before it escalate into something really big.
Yeah.
And also what happened after, because it's good to know like what calm your child down as
Yeah.
well. So I like that you talk about like with the behaviors. And I just wanted to just say that to empower parents to know that whether your child is receiving services or not, you could take note of the behaviors as well.
Absolutely. Yeah, absolutely. You're with them and you know them. You know them best. Um, and I think that's really important that you feel like you are capable and empowered to make decisions for you and your family. And I think that that's really important too. Um, thank you for that. Please, can we move on to the next slide, please? We've talked about this earlier, repeat in more than one place. Um, and I think also going back to what Charlene was saying too, I love this discussion. I feel like we could stay here all night. Um, but I know we have other things to do too. Oh my goodness, now I lost my train of thought now. Praising isn't really important. And also, if you see something happening in the environment that is likely going to aggravate your child, acknowledge it. Wow, this is really whatever the word is, loud, annoying, upsetting. I think, you know what, it's bothering me too. Let's go. And then it doesn't have to be on them to erupt or dysregulate for you to notice. So I think that that's important too. And also, like if something's bothering you environmentally, you know, acknowledge that and say, "Oof, that was hard to get through." Because everybody gets to be human. We don't have to be, we don't have to suffer through things that we don't enjoy. Um, so repeat in more than one place. I do like this tool here. You saying first you do this, then that. That creates routine, that creates consistency, that creates predictability. Same words every time. So that way it helps prepare the person. I worked with a student who he was 16 and I was seeing him in a school and when I would go into the classroom and say, hey, it's time for OT, it would take him 10 more minutes to figure out, what do I need to do? What's happening? Why is all the students telling me you got to go? Why is the teacher stopping class? But I'm eating, so he really needed that kind of cue to say it's time for OT, let's grab our stuff, let's go. And what I did for him is we talked about it private, like in our therapy session, to say, hey, I see this happening for you. How do you feel about it? Because if he's like, oh, it's fine, everybody's paying attention to me, he's not really likely to change anything because he's having a great time. He's the center of attention. But he's like, it bothers me. So I was like, let's practice it. Let's just practice it. And so I was like, we role played it. I said, pretend I'm you and you're me. You come on in and tell me it's time for OT. I'm going to show you what you need to do. Um, and we practiced that in the classroom. And I kind of had that great communication with the teachers to say, this is what we're doing. Please incorporate it. So that's why it's generalizing. And it's not just one person who it's always doing that too. Um, this is something to think about too. Try this, pick one skill in at least three places in your week that you could practice it. Don't do new activities, but moments that are already happening too. That could be transition moments. Um, let's move on to the next slide. I'm looking at the time. It's 7:23. We have 7 more minutes together, and I want to hold time for questions. Going to this point, share what you see with your provider, your observations at home or clinical information. It's so important. Things that you think are really daily routine, goes back to Charlene's point about you're the one that knows your child best. And you have information that your therapist can't wait to know about. And then just recording it, because there's going to be so many great things that happen, and things that are hard that you want to talk about. And then you judge, do I talk about this with my child in front of my child? Um, and just so keeping track of what it is you want to share too. Um, and lead with a report. It depends on how long your session is. I know if you have your provider coming in your home, it's a whole different feel than if you're going out to a clinic. And then they have a set time, and if your appointment starts at this time, you're going to be out by this time. You might want to think about how do you get um the best use of the therapist time, of your time. And maybe it's something that you write down a note and say, therapist, I want you to read this later. But I want you to kind of begin interacting with my child. And then maybe, always think about your child's always listening. So be really cognizant and aware of what is it you're saying, because children are sensitive little creatures, little sweethearts, and they want to know that they're doing okay. Like, I think we all want to know we're doing okay. Um, so a tip, before your next appointment, write down one thing you noticed this week, and then lead with it. And then also, timing too. So let's move on to the next slide. We don't have a 15 minutes break, so we're going to keep on going on. We'll take a break after 7:30. That's our break time. You don't have to sit in the waiting room. There might be times that the therapist might say, hey, I think it might be a little more advantageous if I work with your child over here, or if you're in another room, like if you're having services in your home, you have to take a phone call, and that phone call needs to happen outside of earshot of your child and the therapist. um that's okay too, but you're involved. Find ways to be involved too. Asking questions, even taking notes. um can you show me how to do that? I think sometimes if a therapist, they have something, I think with people as well, they have something in their mind, um but it's not being understood by the other person. It's like going back to communication. Like, what are you communicating? What's the intention? And was it accurately received? And sometimes, like coming here today, the person told me it's left to this particular like location. There's lots of locations left to that. Which one? Which left? So I think really being cognizant of making sure that there's no communication gap,
And it's not all on the parent. I mean, this is also on the therapist too. All parties involved need to be invested in making sure that there's clear communication too. Um, and if you could think of a general question to be like, what should I try this week? Or you lead with that and say, I want to work on this. I'm thinking of doing this. What are your thoughts? These questions work for therapists, teachers, school staff, and everyone else on your child's team, even when formal therapy is not in the picture. Let's move on. I love this slide. I love that as your child grows from like going through like in the home-based services and they're entering formal education, you can see who's on your team, if they're getting special education services, and what each person's role is too. I'll let you look at that too. And then community and support, like We Are Autism, great organization that has a lot of resources for you, parent support groups, even like children play groups and social skills groups and different groups that you could do, like Mommy and Me or Caregiver and Me, is really important too. And also know that there are people you can ask with advocates, to ensure that IEPs are being followed. IEP is individualized education plan. That's like that's something that's a legal document governed by like federal law, state law, and if in the school setting, it's in a school setting, and all those services that are written in terms of how frequent, what's the duration, who's providing the service, all that needs to be followed too. So then advocates can help you with that. And some schools, like all schools have like a family relations like liaison. And that could be a great starting point too. Your school team, community and support by advocates under community and support. That's when, if those are for individuals outside of the school system that might need support, and they might have a legal background, they might be lawyers, they might be past superintendents and or teachers who have kind of do this on a consulting level. Pediatrician is also really important too. It is 7:29, and I want to make sure we have time for questions. You're not just receiving, you're informing. You're in charge. You're totally empowered to kind of make sure you're getting what you want for your child, for yourself, for your family. Here are some questions that you can ask, and really make sure that you're understanding what it is specifically, and you're totally concrete, totally clear and confident in what is happening right now. So yep, partnership is into the school too. It doesn't end. You're running the show as the parent too, and you deserve a real partner. Sometimes it's not a good fit between the provider and you and your family, and it's okay. It's okay to say, you know what, I don't think this is working. You could ask for a different provider through the same like organization, and it just sometimes it works well, and sometimes it's not a good fit for whatever reason. Maybe it's scheduling, maybe it's just personality. Um, it does, at the end of the day, there's a right provider for you and your family. These are some questions that you can take with you too. Thinking about what's one routine that breaks down. We do have a handout for people too, so that you can kind of think on that too. And then I think if we go to the next slide, I think there might be, yes, here's information about Coral Care. If you're thinking you want to explore different services and what that might look like, here's the phone number and an email address, as well as the website too. I think this is probably the last slide. Is this the last slide, Lindy? Oh, wonderful. Thank you so very much. I'm so glad you were here tonight. I appreciate your engagement. I want to thank We Are Autism. I want to thank the Hispanic American Library. Lindy dropped in the chat some information about Coral Care. Shanice, I see you have your hand raised. Please unmute yourself and share.
Sorry, I just wanted to ask about the last two slides.
Okay.
I know you said handouts. Well, could you email me those? Just so I can have those information on hand, if that's possible.
Yeah, Charlene's
So
gonna send those out.
I'm actually putting together.
Charlene's putting something
I'm
together.
actually putting
You gonna
together a
you
binder.
gonna email to everybody or just because yeah, I want the three last slides. I took two pictures, but I missed one.
No worries. I'm putting together a training binder that's going to include information for all of the 8 sessions. So whatever paperwork that I get from each organization, such as Coral Care, it will be under week 2 in the binder. So yes, you get all the slides. You guys would pass it on to me, and I would definitely make sure
Great.
you get a copy of the binder.
And I
Great.
just put in the chat the email address I put on here, that hello, that's more for like booking appointments for the people that you want that need services. But if you have questions about this talk, or if you want access digitally to the slides or to the handout, email that clinical team at Join Coral Care email address, and we can send it to you through us through directly as well, and answer any other questions you have.
Thank you.
I know we had to speed through the
I
end.
send out for example last week I sent out the video, the recording of week 1, and I will do that again for this week. So this week, everyone that I have your email, I'm assuming that I must have your email while you're on this Zoom today. So go ahead and email you out this week recording as well. And it's also going to be on my website and also on my YouTube page. So there's ways I would definitely make sure you guys get this information for sure.
Really glad.
Thank you, Charlene.
Of course.
Thank you, Charlene, for doing that. So I think that's yeah, having resources is really important, and I think you have a really great resource here with Charlene and Coral. Karen, I and Lindy are really happy to be here with you, and we want to serve as a resource for you too.
And as parents, you're your child's best resource. And I think the first thing Jennifer said earlier, about you don't have to be your child's therapist. You can be their best advocate, but you don't have to always be therapizing them. You can be, they're just their parent, their playmate. You don't always have to be, working towards a specific goal. I think that's the number one takeaway from this. So, yeah.
Shanice.
Yes, guys. My big question, I have a job where I work literally from 11 in the morning to 7 p.m. in the night.
Yeah.
I missed out on a lot of time with Kason. I feel so bad as a parent having to leave that to his teacher, Mrs. Buck, and Lori from the ABA service. I try my best to put all the help in place that he's gonna need because I'm not there. But how do I not just keep carrying this? Because I want to be there for him. I want to I try to leave let them do their sessions and stuff, but I don't want to lose any bond with my son. At the same time, I feel a little guilty in my heart.
Thank you for sharing that, and I want to honor your vulnerability and your authenticity of sharing that too. I think as mothers, women, we want to be everywhere for everybody at all times, and you can't. You can't be everywhere because you're holding down a job, you're providing, and I think that's part of the priority too. And I think also give yourself peace and grace that
Yeah, for sure.
there's going to be nothing that's going to interrupt that connection he has with you. I think kids know who has their back and who's looking out for them. And he knows mommy's working. And I think also it's important too, especially to realize he's not going to be this age forever, ever. We're all not going to be this age forever. But
No, it's just that sometimes the way I see him bond with his teachers and his it pulls at my heartstrings a little because he has autism. His brain is wired different. He thinks differently. He processes everything's differently, and he receives information differently. And to be able to communicate with him on any level, like I was so happy the day when he said, "Mommy, please open."
Mm. Big day.
Like I'm he so I mean I need my job, but I hate my job because I know I'm trying to. I will.
Give
I
yourself
that's why I'm here. That's why I'm getting all the help. But I just
definitely give yourself some grace because at the same time we have to provide. That's another way of taking care of him is to make sure that all his needs, not just you being there physically, but you have to think about that you have to be there financially as well. And from what I heard from you is that he feel good with the person, with his teacher.
yeah.
So that's important too, because
Mm.
oftentimes like we have other people have to step in and help us care for our kids because we can't be there all the time, and sometimes we're left wondering if uh, is our child really happy there. But from what I'm hearing from you is that he and his teacher bond, and that's a blessing right there. So
I mean, I had to fight because, with everything with the smaller class, like I have to keep on top of everything with Kason. And that's why sometimes I feel like I push myself so hard when you guys say, give myself some grace, give myself some time. But I feel like if I slip up, is he going to be comfortable with this person? It's like the first time when he did ABA service, he wasn't comfortable at the center. He wanted to do it here at home when he comes home. Okay, I did it at home. He had a meal, and he didn't like him. I had to switch. Is sometimes I feel like because I try to be part of it, I try to learn the stuff too to like keep engaging with him. But I feel like I also fall short where like even at his graduation, I'm noticing, oh my God, the way he interacts with Mrs. Buck. I'm happy. And Mrs. Buck does keep me up to date, but it is like, you want that bond with your son, like you want with your daughter. And I want to understand him. I'm putting out the best effort too. Sometimes I don't. And like that's why I'm trying so hard to keep up
connection
on
you
top
have,
of everything.
the connection that you have with your son, Mrs. Buck can never replace. You gave birth to it. Yeah, the connection Mrs. Buck
You're
could
right. You're
never,
right.
never
Mm.
replace. You're his mother, and that bond is there. But I'm just speaking, I'm not the professional. I'm just a mother. And as a mother, what I know that providing for your child, making sure that there's a roof over his head, clothes on his back, and food on his table is just as important as you being there for him during different behavioral issues, or trying to get him to communicate. So don't just look at just one part of it. Like you have a pie, don't just look at just that slice alone. You have to look at the whole picture, because we as parents, we know while you can go without your kid, the last thing you want as a parent is to watch your child go without. You're not going out there to party. You're not going out there hanging out with friends. You're going out there to provide for your kid, and that speak a lot. And you're doing a good job by going out there and provide for your kid. So don't you dare feel guilty for going out there to provide. You feel guilty if your kid is not at a safe location while you're going out there to provide. But if your child is okay, and you would know if your child is okay or not, whether or not they could speak or not. If your child is okay and you're going out there to make ends meet, by the grace of God, you go out there and make ends meet, because at the end of the night, your kid need a roof over their head and shoes on their feet and food on their table and clothes on their back. So don't feel guilty for providing. That's just
What Charlene said. Yeah. Yeah.
Um,
I think too, like,
Shanice, I don't have the answer, but I'm a parent as well. And I know it's easier said than done. So I do want to let you know that I hear you and I can't even imagine what you're going through. But keep hanging in there and just know that things will align. You're doing the best for your for your child, and I hear it, and I hear your pain, and I want to acknowledge it. So just keep hanging in there, okay?
He's such a beautiful boy. I love him. Like I just I wanna engage with him more. I know I'm doing the right thing. I'm putting in the best. I try to get him the best dentist, the best teachers. His book is fantastic. ABA service is wonderful. I'm getting him in the right school. Frederick Harris was beautiful. Their IEP was wonderful. Springfield Public School is done right by him. I know him, but is when you
It's good.
yeah.
I think too, Shanice, if I may add too, I think making sure that you're surrounded by like an uplifting community. Like I loved how, I don't know if y'all know each other, but like I loved how
Mm,
Carrie Ann was kind of like, hang in there. I see you. And I think that that's important, that your beauty and your struggle and your wish and your heart's desire is like fully honored. And I think being around surrounded people and uplifted by people who see you is going to be important. And I also think too, what like creating like that vision for what it is you want in your life and how you want to engage with your son, what ideally that looks like, and what action steps you can take to get closer to that ideal. Maybe it's a schedule, maybe it's work, maybe it's type work. I don't know. That's beyond the scope of this conversation, but I think as you know, we're all trying to like reinvent ourselves and trying to do the best by our kids and also keep our sanity while we do that. And I think it's a tall task. And I think that, making sure that you're uplifted and cared for as well. And sometimes we're the one caring for ourselves as well as caring for others too. And I think that that's important
mm,
to say, yeah, it's hard. This is hard.
Yeah.
And it's not fun. And also it's not
And it like idealize what it's like. So like if you were home, you know, all the time with him, like that seemed like right now that might seem like, oh my gosh, this would be amazing. But honestly, I think there are so many parents who actually are better parents because they work. Like
oh,
I work full time as well, and I have kids very similar in age to you. I have a 4-year-old and a 6-year-old, and I think I'm more engaged with them the times I am with them than when than if I was home with them all the time. I think I would be dysregulated. I would be like frustrated more and not feeling like I was filling my own bucket. I know you said you don't, you're resenting your job, and I totally, hear that as well. But I do think that maybe having some of that, I think sometimes we like imagine these like perfect situations that we're not in, and sometimes actually it might not be that great. You could be, you might actually be more engaged with your son because there's less time for that. So I don't
I
know.
know the little times that I do have with him is like this is the thing when by the time I leave work at 7:30, by the time I get him, because his dad he's so sleepy. He wants to go to bed. He has no time. And then I have to wake him up in the morning and get him ready and he's gone. So like I barely get to it's like maybe on a Sunday if I have the weekend off or
yeah.
because on a Saturday my mom wants to take him to church. She takes him both to church. So it's like and then I'm like, okay, all right, ABA service in the evening. Maybe I can engage. Maybe one or two time I might come into the class and if I'm there. But now because of the high prices going up and the rent and everything, I have to switch to full time. I can't do part time again like I would and be able to like be there and spend a little time with him and let him know that hey, mommy's here. You're safe. Because at one point he was your danger. He would not go near anyone. He would clutch on to me as soon as any come close, and I had to break him out of that. And sometimes I think like, is he comfortable? Does he not? I will purposely call his teacher just to check on him. How is he doing? And I know is I trust them. I give them room, and if anything, I know they do reach out to me. They do love him, but at the same time. on purpose. I am literally changing my job, trying to train for a different job so I can at least have a bigger pay rate and work maybe a little less to spend time with him. What I don't want is to miss out on a critical bonding time with him where he knows he's safe and you're secure. There's nothing wrong. Mommy's here. Your sister is here. I try to make sure he spends a lot of time with his dad and grandma so that he knows that if mommy's not around, at least you have these people that you can lean on.
You're doing an amazing job.
You are, you really are. Shanice, take care of yourself too. Like
Yeah.
something that came to mind as you were speaking was what I want to share is like make sure you're taking exquisite care of yourself and think about what does that look like? What does that mean to take exquisite? This is for everybody. I'm exploring this too right now, and I have lots of lotions, lots of lotions. So, like feel like I'm taking care of my skin, and so I think I invite you to think about taking how to take exquisite care of yourself and I think you're doing all the right things. You're thinking about how can I change circumstances that align with my values and my life purpose and my boy and my children. So
It's funny you said that. I haven't thought about myself since I had these babies.
I know, Mama. I know, Mama.
Well, week 7
I
is
don't think I
actually
ever bought myself anything.
out, so
Oh my God.
Yeah.
yeah,
I'm
there's
sorry, it's been
I think
about
stay
that,
with
but
these theories too, Shanice. And I
yeah.
think really, I think also something that came to mind too is like kind of engaging like with a flexible thinking, like what has to change so that I feel more present. And that doesn't mean it's going
yeah,
to change, like you're going to be like, I'm changing it right now. It could be like, huh, that's an interesting thought. And it could be like, where am I being rigid? And I'm not saying you are being rigid, but maybe if there's
mm,
like a inflexibility to be like, this is how I have to make money. And it has to be between these
yeah,
hours. Maybe there's another
mm,
skill, talent, expertise you have that's in demand. That's not that's not dictated by somebody else or a system that confines
yeah.
you. Where do you need freedom is where I'm thinking.
I haven't. I don't even remember what a vacation is like. I'm
I
so
know. I know, but
It's been 10 years. Oh Lord. But I know I'm supposed to take care of myself, but it's like it's like when it comes to him or Amelia, this mom thing just pops out of me and I can't stop. But I know I'm supposed to do this. I do take the time to like de-stress. There are times when even Kason and I are overstimulated by each other and we have to like separate ourselves. We be in separate rooms.
yeah,
um there a lot of times you have to like breathe and be like, this is a rough day. He doesn't want to have a bath. How am I gonna do this? Oh my God, he's sick. The worst is when he's sick. He does, and he has to go to the hospital. He likes nothing on his face.
yeah,
He won't take medication.
yeah,
It's a sometimes it's a three-man job just to hold him,
yeah,
just
yeah,
to get him. The worst was when he had pneumonia, and we literally had to put weights on his hand, those little weights to
yeah.
keep the IV in, to keep the on his, and it was just awful watching him like that. But he's a strong boy. Like I said, I'm gonna do all you use every resource available to me, guys, like as much as possible. I know I
Mhm.
can't do anything about my job right now, but that's why I'm trying to get into training and trying to look at what might work, what's flexible. I did take time off now because I want to get him settled into a good summer school that's gonna help him.
Good.
And I heard about this new school that they're for autism because on the spectrum. Gonna check that out, see if that's gonna be comfortable for him.
Mhm.
Um, gotta check out a new dentist because up to now the dentist has looked in his mouth. He likes an electric toothbrush and he won't. He likes Colgate. That's weird. He prefers Colgate. And to get him, I have to try all these stuff. Sometimes I gotta trick him with a song to get in and out. I know I'm doing what I'm supposed to do, but sometimes it feels like I'm always at work And sometimes that's what I'm saying. That sometimes I build a resentment at work because it feels like I'm always there. I'm just always there. And by the time
Yeah.
I get him to spend any time with him, to hug him, to maybe even kiss him, he's so tired. He doesn't even want to, he just wants to go to bed.
So I
Yeah.
just believe us as parents, we're just always gonna have that guilt, and this is one of the reasons, like I partner up with the Hispanic American Library because I say to Unera all the time, I'm like, we can't be the only parents. There gotta be other parents out
Yeah.
there. So listen to you speak and I can resonate with what you've been going through because I am going through it myself. I just believe again, this is why this session is so important. And I just want to say just real fast that next week it's going to be building structure and routine at home, and it's going to be with Jacqueline William Ines. But all session is dedicated to us as parents and what we're going through. I know you guys mentioned the IEP, and we have a week coming up, which is week 6, partner with school and providers, and that's going to be with DDS. So then more of you guys' questions can get answered. But I appreciate you coming on, you guys doing this session with us. I appreciate every parent that joined, or everyone that have some relative or connected with someone that's on the spectrum. you know just listening to you guys be able to like bounce ideas, or just listen to what you're going through, and then we could sit back and be like, oh yeah, I'm going through that just the same, and make us not feel so alone, because that's one of the things I hear a lot from parents that have kids on the spectrum, is how alone the journey is. And I know the journey can feel so alone. Another thing that I want to say, and you never could say it, I'm going to say it real fast, that she have an amazing program where monthly, is it monthly or 6 weeks?
It's monthly.
Monthly?
We added you in there, so we
Okay.
combined it, so we
So,
won't have the same
yeah.
part of the same thing.
So like monthly, she have it where parents meet in person here at the Hispanic American Library. Like for last month, she did a documentary on a father's perspective of raising a child that's on the spectrum. Because a lot of times you hear from us mothers, but we don't hear from the fathers how they're feeling. So, like I just want to bring that up because I've been to the last two meeting that she have, and I find it to be very encouraging to be amongst other parents that are walking the same journey that I'm walking, and it made me just realize that I am not alone. We have a community. We just have to like find each other.
Yeah.
So just wanted to say that before we go.
Thank you, Charlene. Thank you.
And
Thank you all
thank
for
you, Charlene. I really appreciate this. I've learned so much tonight. And I'm so thankful and grateful that you have created this space for a lot of people. Shanice, I hear your story and I feel for you. As a parent, it's always a hard task for us to leave our little ones, but just find peace, find assurance, just knowing that you're doing the right thing for him. Thank you again, everyone.
Thank you, Carrie Ann. Thank you everybody for being here and participating tonight. And I feel like we should have like a big sleepover right now. But I think somebody wants their computer back. So um I think we'll close out right now. Is there any other announcements or anything, Lindy, that needs to be shared? Anybody else?
No, just thank you everyone for joining tonight.
All right. Love spending time with you. Have a
Janice, it's
wonderful
good to
night.
see you. I haven't seen you in like 2 years plus, but it's good to see you on here. Bye. Good night. Bye.
Night,
Good night,
everyone. Be well.
guys.
See you next
Bye.
week.
You too next week.
Bye.
Good night.